I saw a number of patients today in my clinic who had heart surgery over the years. One of them had his heart surgery 3 years ago. He had mitral valve prolapse, and this was causing him to be short of breath because the mitral valve prolapse was causing mitral regurgitation, which is a leakage of the mitral valve. And what happened in this patient was that this is the mitral valve, this is the posterior leaflet of the mitral valve, and you can see that some of the cords which support the posterior leaflet of the mitral valve had ruptured. And so when the valve closes, it was not meeting the other leaflet, the anterior leaflet, at the same place. And so there was a gap, and this had caused allowed blood to leak backwards towards the lung during the heart contraction, and this had caused him to feel short of breath. So to repair the mitral valve, we had to make sure that the two leaflets of the mitral valve were closed at the same place. And so there are a number of ways to do it, to repair the mitral valve. And in this patient, we chose to use some artificial cords, which are made of Gore-Tex sutures. So these sutures are placed around the papillary muscle of the heart, deep down inside the heart. And then the other end is passed around the mitral valve leaflet. And you can see that we have used 3 of these Gore-Tex sutures. And what we then do at the end is that we then adjust the length of these Gore-Tex sutures so that the two mitral valve leaflets would meet together at the same place when the valve closes. And at the end of that, we suture this annuloplasty ring onto the mitral valve apparatus around the mitral valve leaflets. This is a bit like a door frame which we use to support the heart valve to ensure that the valve repair would last the lifetime of the patient. So this patient came for his review today, and he's very well with no symptoms and is living a normal life. We did an echocardiogram and was very pleased to see that both leaflets were working normally and closing together at the same place, and there was no mitral regurgitation. There was no leakage of the mitral valve, and his heart function was normal. So thank you for listening. I hope that was interesting. Please do like and share this video if you found it informative. Thank you.